Hello, everyone. Welcome back to our channel, and you are welcome to Lifelines. We are so happy to have you here, and we have also another friend with us today. Her name is Ani, and she's going to tell you a little bit about herself.
Hi, everyone. It's so nice to be here. I'm just so excited to be on the channel and talking to you. So just a little bit about myself. My name is Ani Kazanjian. I just graduated from medical school. I got my medical degree and simultaneously got my master's in public health. And before I was in medical school, I was actually a nurse. So a long time ago, I went to nursing school, and then I served in the military for 5 years, and I did trauma nursing, and I also worked in the operating room and got certified as an OR nurse. And that is really where a lot of my interest in pursuing medicine came from. And I knew that I really wanted to be involved in surgeries, and I wanted to be involved more autonomously in patient care. And so I decided to pursue medical school. So I ended up going to medical school. Like I just told you, I got 2 degrees while I was there because sometimes just one is not enough for me. And so I did that, and then I am now going to be starting orthopedic residency next week. And another fun fact about me is that I'm also a single mom of a toddler. So I don't know a lot of other single parents in medicine. So I'm excited to share with everyone what it's like to be a single parent in medicine and how you can be unique in terms of your family structure and your background and what you bring to the table. And medicine is a place for all of us. So we're all welcome here.
Yes, thank you so much, Ani. So I know I am now considered a non-traditional student after graduating from undergrad and going on to this med school process. Can you explain to us what a non-traditional student is?
Well, I feel like non-traditional, and everybody probably has a different description. For me, I would say a non-traditional pre-medical or medical student is a student who did not go directly from high school to undergrad to then medical school. And the reason why I include high school in that is because a lot of people have breaks between high school and college and medical school. So anyone who had a break at any time in their educational career, I think is considered non-traditional. Now, of course, non-traditional, I think, is the new normal. And so I don't think of it as being that different. And now I see people who go directly from high school to college to medical school. And I say, well, that seems different. Actually, most of my friends took time off. So I think personally that non-traditional is the new normal, but it's still the definition that I think we use.
Yes, I love it. So yes, if you are currently on this journey or thinking about this journey, you are most likely a non-traditional student at this point. So we just have a lot of questions for Ani. As she said, she's a single parent with a toddler and has gone to medical school, has also been in the Army, and has also been part of a large amount of nursing training. So as you said, you were in nursing your past career. Just tell us a little bit about what made you want to go into medicine.
Well, I have to say, I originally went into the medical field because I did a medical trip when I was in high school, and I was down in Central America, and I was doing just some basic help for the team, and it really inspired me, and I found that I really liked caring for people, and I loved the scientific aspects and things like that. So I knew I wanted to be in the medical field, but I actually didn't know a lot of women doctors. So in my community, I had known some male doctors, but not any women doctors. And I did not know anybody who really had, well, I didn't know any women doctors, but I had never seen anyone who had been in medicine and also been a mom and also had other, facets of their life and things going on. So when I was considering medicine, I didn't have any role models that I could see that I was like, oh, I could do that. And so what I did have was a lot of fantastic nursing role models. And I saw that it was a very diverse career. And I saw that you could pursue all of these graduate degrees and really go a lot of different ways with it. And I really liked all of that. I liked that I could get done with my undergraduate and have something concrete that I could do right away. It didn't take any more training. And so or academic training anyway. So that's why I pursued nursing. And but while I was in nursing, I quickly saw that it really didn't have all of the things that I was looking for in my career. In particular, the level of autonomy and the procedural aspect. I think a lot of graduate nursing programs, you get pieces of that, either the autonomy, maybe working in a clinic and seeing internal medicine or family medicine patients, or even gynecologic patients if you're a women's health NP. Or then maybe you could be a CRNA and you're doing all procedures and you're in, so certified registered nurse anesthetist, I think.
Yes.
So you're in the OR, and sad I don't know that since I work in the OR. But yeah, so like they're doing all procedures, they're in the OR constantly. And so they don't really see any patients in an outpatient setting or do any consultations or things like that. So there are different facets and areas that nurses get to work in, but I wanted to have it all. I wanted to see the patients in the clinic. I wanted to do the procedures. I wanted to be in charge of my own procedures. Um, and all those different things. And so because of that, I was really pushed towards pursuing medicine. And then once I got into the military, I knew so many women doctors and so many fantastic women role models who they knew they were juggling it all. They were having their family life. They had partners who were busy and had their own careers. Some people had partners who stayed home, and then they had kids. And I suddenly saw it as a possibility for me. And so then I was like, oh, I could do this because I see other people doing it. And that's something I think that came up later on in my journey in medicine, which you can talk about more. But when I became a single parent unexpectedly, again, I was kind of, it came into play. Can you be what you can't see? It's so hard. It's so hard to be something you don't see. And I had no examples of single parents in medicine. And so for a while, I considered not pursuing orthopedics, which had been my dream for 10 years. But I remembered back to that experience I had in the military, and then back again to the experience I had in high school. And I realized, there was a time before that I decided not to do something because I couldn't see anyone else doing it. And it turned out that I could do it and other people are doing it. And just because I don't see them in the moment doesn't mean they aren't there. And so when I was in medical school and I was confronted with that situation again, I was able to say, no, I'm going to go for this. I can be this, even if I don't see any other people who are doing exactly what I'm doing. And so I think that's how I ended up in medicine, and that's how I ended up continuing to pursue orthopedics.
Wow, it's so crazy how like you start one path and you think like this is my path, this is it. And then once you get there, it's like, no, this is it. It's so crazy because I also like experienced the same thing as you because I didn't see other African American anyone like in terms of the medical field or anything. I always was just stuck on like that's too hard or that's not for me. And it's like a subconscious thing. Like I don't think back then I would say I'm not going to do that because I don't see myself doing that. I think it was more of like you don't see it so you don't believe it type of thing.
How can you think it's possible? Like, that's the thing, is like, if you're not seeing people do it, you're like, well, how could that be if I don't see how it could happen? Like, am
Mhm.
I really willing to just forge that path and say, I'm going to just figure it out? Or I'm sure there are people out there doing it. It's so hard for young people, I think, in particular, to look around and say, it's okay that I don't see anyone on that path. Because when you're young, you're looking for those role models, and you're looking for like, what is life like when you're an adult, and what will it be, and how does it look, and what is my life going to look like? And you want to kind of see yourself in other people and in places you can go, and people who are doing the things you're doing. So representation, as you know so well, more than I do, is like so incredibly, incredibly important. And so I'm glad that you decided to go to medical school and that you got there. And I'm happy that I got there. And it's just, I think it's a great thing.
Thank you for sharing that. So the next question that we had, since you were talking about like representation and things that you didn't see, can you tell us a little bit about your experience being a single mother and going to medical school? Like, I can't even fathom, like, how do you maintain that? And it's like, you would think that with that thing that of you going to medical school that you were like just like careless with your child, but no, you spend a lot of time with your child. You are very involved in their life, and it's really obvious personally for me. So just tell us about your experience with that.
Well, first of all, I love being a parent. Like, my child is absolutely the greatest blessing of my life. And the blessing I didn't know was going to be the greatest blessing of my life. And so for me, I think what's really special about being a parent that's different than being a single person is that, you know, when you get up in the morning and you're doing something for your work. So I had already made this choice that I was going to pursue medicine. I was already in medical school. My plan was not to be a single parent. That happened extremely unexpectedly. And so I remember just sitting there and I was holding this 4-week-old infant and I was like, I don't know if I can do this. But the thing was, I was already doing it. And when you're there, like there's not a choice in the same way. Like if you're tired and you wake up one morning, you're like, oh, I don't feel like getting up today. I don't feel like giving my best today. Like, and maybe no one's relying on you. When I get up in the morning, my son is waiting for me to do my best so that he can have a good life, so that I can spend time with him, so that I'm working towards having a better, more flexible schedule. Like all these things I'm doing for him. And so that gets me going and it keeps me going and it keeps me working hard. And then because I'm sure like pretty much every parent feels this way. I love my child and I want to spend time with him. And so, yes, he's very young and can't have real conversations. He knows like 30 words, but I love spending time with him. And so it also motivates me when I'm at work and when I'm at school to really prioritize my time and use it very carefully. So if there's studying I have to do, I don't have experience in residency yet because I haven't started, but in medical school, I would always make sure that if there was downtime when I was in school, I was really using that time well. And I was studying, I was preparing, I was writing out notes, I was, you know, answering emails. I was doing the things I had to do so that when I got home, I was ready to spend time with my son, because your time is limited. And that's true of parents in medicine and parents who work in other jobs, of parents who are nurses, of parents like this is common for everyone that especially in modern day US, we don't get a lot of time to spend with our family and spend with our loved ones. So for me, it's about taking the time that I do have and really making the most of it.
Wow, you certainly did that. You certainly did that because you graduated from med school and you got into one of like the most top specialties. Like orthopedic surgery is a very competitive specialty to get into. So to do all of that and still maintain a healthy relationship with your child is just so amazing. So amazing. Thank you for
Mm,
sharing that.
thank
Do you
you.
have any advice for any single parents or parents who are considering going into medical school and they have a child or a few children or anything like that?
Well, I think that what I would say to them is probably the same thing I would say to everyone. First of all, the journey into medicine, it's a marathon, it's not a sprint. So if you're thinking about doing it, you have to be ready for the marathon. So it was 10 years ago that I decided I wanted to be a doctor, and I've graduated from school today. And I remember it being 10 years ago and saying, oh my gosh, that's so long. I've planned it all out. I've looked at it. I've sat down with my paper and pencil and written out all the steps it's going to take. And it's going to take me 10 years. And who has 10 years? That's really long. Well, guess what? It's been 10 years. I don't feel as old as I thought I would feel. Like, it's a lot better than you think. And that time went by pretty quickly. And here I am, and I've graduated. I'm starting in this career that I'm super excited about. So that time will pass, but know that it's going to take a long time. So if you're thinking I'm going to get into this and I'll be able to like whip it out in a short period of time, that's not likely. And so have a realistic expectation for how long it's going to take. And if you have a partner, like take the time to talk with your partner about what that means for you financially, what that means for childcare, what that means for relationship expectations, because it is a long time. And so if you're not talking about those things in advance, it can be frustrating, I feel like, for some people, and make it a lot more difficult. So those are two things I would say for single parents in particular. It will take a lot of help. I live with a family member. My sister lives with me to help care for my son. And she's not full time caring for him, but half the time she's caring for him. And then I have a nanny, and then my parents live a block away. So I have a lot of family support. And if I didn't have that family support, I would never have graduated with both degrees on time. It would not have happened. just financially considering. And so I think that it's important to be really honest with yourself about what help you're going to need. Because for me, I know I took a big pay cut going from the military. I had a great career, and I went from the military, I went into medical school. And then from medical school to residency, because I continued to work as a nurse in medical school, I'm taking another pay cut to go into residency. And so thinking about all those things in advance is really important. And it's not saying it's impossible, and you should do it if it's your dream, but really think about it beforehand and make sure that you're prepared and you know what's going to happen, in terms of like what you're going to give up and what you're going to need in terms of help. So those are like the nuts and bolts of the basic things. But so I'd say family, think about the financials, and consider partners and other relationships that are important to you. But otherwise, like, I have met other residents who are single parents, and I have met other med students who are single parents. And I even met a recent grad from orthopedic residency who was a single mom during residency. And so it is possible. People are doing it. And just because you're in a situation that may look different from others around you, it doesn't mean you're less qualified. It doesn't mean that you shouldn't go for it. It doesn't mean that you shouldn't, attain that, because I truly believe I got this degree in public health. And so I had a lot of training in like social determinants of health and epidemiology and things like that. And I really strongly feel that like people in difficult or unique family situations who don't pursue these high achieving professions, like that's really like exclusive, and we shouldn't be doing that, because it's not fair that a person could not go for like orthopedic surgery. Yes, it's very competitive. It is also very financially lucrative for the people who go into it compared to other fields. And so if you're a person who is at a deficit in maybe terms of like childcare, or you need extra help or things like that, and then you're not going into this field, like how unfair is that? Like we're creating barriers for people in terms of equity and equality. And it makes me so mad. And I know that I'm so fortunate that like I have my family to help me, and that's why I can continue to pursue this. And I'm so incredibly privileged compared to many people. So I would never, ever, ever, like for a second, disregard how much privilege I can walk into the room with. But I really think other single parents should be here too. And whatever I can do to help get people here, and like single parents, different backgrounds, people who are underrepresented in orthopedics in particular, we really suck at being a field that's represented. And so we have to get everyone in here. So I've like got on my soapbox, but this is that's how I feel about
I'm
that.
like soaking up the wisdom. I'm like soaking it up. I'm also on this journey, so I'm like taking it in. But this is so helpful. Like you hit on, like I feel like all of the points that you're hitting on, I don't feel excluded because I'm not a parent, but I feel like I'm literally able to take it in because it's all advice. Think about your financials. Like for me, I was offered a job at a hospital, and it's like one of the hospitals that I think I would apply for residency. Like I wanted that hospital so badly. And it was either post-bac or work. And it was just like, when you're faced with this type of thing, it's like difficult on what to pick. Like, do you want a pay cut, or do you want to get to your dream in a more faster way? Like, I don't see myself doing nursing long-term. So why push back your dream for that?
And and you have to think about your pay as an attending physician.
Yeah.
So anything you do now is preventing you from getting a year of attending salary. So think about the difference there. But like, again, that's like such a privileged position that I'm in, to be able to say, like, I'm going to defer for a year and do this. Like, how many people, like, I'm going to defer and get another degree. I did that. Like, I did it for very specific reasons, but I was privileged to say, I'm going to delay my entrance into residency, which means I'm giving up a year of a salary as an attending. So like, or to say, I'm going to go to the post-bac instead of taking a job, or I left the military instead of staying in that career, which was, really great job security and upward mobility. So like, I don't think it's wrong to say, I see where I'm privileged, but I also want to help people get to where I am.
Got a lot of barriers.
It's all here.
You know, we have a lot of barriers that you could talk about. So we really appreciate that. So I guess I'm just gonna bounce around, but the next question I had for you, which is a big question that I get on my channel, I'm sure you probably get, but a lot of people ask this: should you go into nursing if you want to go to med school?
So I would say we were talking about this before, so I had to save my pearls for I could have talked about this forever. But I would say that most of the time I would say don't do that. And it's for a very specific reason. And honestly, it's financial. I'm a very like realistic person, and I feel like I've talked about this a bunch already. But think about it this way: you go to school and you are going to 4 years of undergraduate, and so you're paying for 4 years of undergraduate. And in nursing school, as you know very well, there's a lot going on. So you don't have a lot of time for extra classes or other things or other activities. So the things that you would need to do to prepare yourself to be um, like a good applicant for medical school, you may not have time for all of that. In fact, the prerequisites for medical school and the prerequisites for nursing school, unless you're in a direct admission nursing program, um, the a lot of people, or at least they did when I was in school, was they still took 2 years of prerequisites and then they applied to nursing school. So not every nursing school is direct entry. Mine was not. I went to Johns Hopkins, and so people would take 2 years of prereqs and then they would apply and go to Hopkins for 2 years. And so, like, basically, those prerequisites you did in nursing school are not the prerequisites you need for medical school. And so, in that sense, you're kind of like taking this time to do a degree that you may never have an intention to use, and quite frankly has not allowed you to prepare yourself for the future you do want to have. So then when you finish nursing school, you have to then study and take your NCLEX, which is hard. And then you have to go back and start taking classes to go to med school. And that will take you 1 to 2 years. And then you have to apply to medical school, which, if you want your application to be ideal, you will apply when everything is done. And so that'll take another year because the application process is a year, unless you go to a post-baccalaureate program that links with a university that has a medical school, in which case you may be able to speed up that application process a little bit if you're fortunate to be accepted into their linkage. So you've basically taken 4 years of a degree and spread it out to get to your actual school that you want to attend to be 6 or 7 years. My recommendation would be, if you're not sure if you want to be a nurse or a doctor, go get a science degree. Spend your 4 years studying biology, get all of your prereqs for nursing school, get all of your prereqs for medical school, participate in your clubs, do your undergraduate research, get your volunteer experiences, really beef up your application, look really like polished and ready to go. Then if you finish school and you still want to be a nurse, do an accelerated program. You'll be done with nursing school in like 1 to 2 years and you're ready to go. But if you want to go to med school, you could take a gap year and apply to residency, medical school, and you're ready to go in a year. And that's, to me, seems much more fluid of a concept. The only times I would say it's a good idea to get a nursing degree in advance of going to medical school are, one, if you need to work before you go to medical school. And if you already know that you're in a position where you're going to need to work before pursuing medical school, nursing is great because it's shift work. You could start working right away. You can get that clinical experience while also like making money. Like when I was in medical school, I didn't shadow doctors. Like my peers would go and shadow doctors during their off time. I would go to work and then I would shadow doctors at work. And then I would see operations and talk to surgeons because I worked in the OR and I was getting paid for my shadowing time. So because I needed to get paid because I have a kid. So like in that sense, that can be helpful. But people who think I'm going to go to nursing school, then I'm going to work as a nurse while I'm in my postdoc and then in medical school, it's not going to happen because nursing is very difficult and you need training after school. You are not ready to work as a nurse right away after you finish school. Most hospitals require that you do a nurse residency program, which can take upwards of a year. You're on a very strict schedule for that first 6 months to a year as they train you in the area you're in. So you're not kind of able to take the classes you want. In fact, I know of a girl who I worked with when I was in medical school, and she was in nurse residency, and she was just trying to go from her associates to her bachelor's in nursing. And she couldn't even get the one class she needed to go from an associate's to a bachelor's which was required by the hospital that she go from an associate's to bachelor's. You can't stay an associate's nurse forever at most hospitals. They require that you get a bachelor's. So she was doing what the hospital told her she had to do, and she couldn't even get the one class she wanted to get around her nurse residency program and her new nurse orientation schedule. And to me, that just says it all. Like, she couldn't even do the one thing the hospital was telling her to do. How are you thinking you're going to be able to go and take post-bac classes and study for your MCAT and really give it 100%? It's not possible. And so bottom line, I would say, if you got to work and you know you're going to work for a few years and you have some extra time, get the nursing degree first. If you have some sort of scholarship that says you need to be a nurse, like I did, go and be a nurse, because that's what your scholarship says and that's how you're going to college. Like that's worthwhile. But those would be the only reasons. Otherwise, if you know that you have an idea that you want to be a nurse or a doctor, you're not leaning one way or the other, get a basic degree. If you're thinking you want to go to med school, just go to med school. It's okay.
And very easy. I completely agree with every single thing you're saying.
Oh, and your situation. I didn't talk about your situation.
Oh, yeah. I have that
so you
one.
can talk about that. That's the other situation. I would say it's okay to get your nursing degree.
So I was in my third, so my program was direct entry nursing school. So I was in my third year out of 4. At the end of my third year, that's when I was like, okay, this is not just a thought. This is something that I really want to do. So when you're at the end of your third year, you basically, I don't want to say you've hit home, but like you have one more year left until you can be able to say that you're a nurse. So it was like, there's no point for me to just say, forget all of these things. And I don't think I was personally ready to let go of nursing, because that was all of me. That was my volunteering. That was my study group. Those were my friends. So to finish the 1 year just made the most sense to me. But I utilized that 1 year to really say, how can I really maximize my time? And how can I really be able to have a great med school application in this time of like transition? Like, for example, I planned out for my next semester to take extra classes that were like very minimal in terms of like how much time they had to take from me, because I wanted to understand the transition from nursing to science classes. So I took a food science class and I audited Gen Chem 1. So I did little things like that instead of like completely switching my whole schedule
Which
around.
makes sense. Because
Yeah.
you to get your bachelor's. And so that falls into that. Like, if you're already getting your bachelor's, don't switch, because then you'd have to basically start over again, which would be a lot of extra years and extra time and extra money. So finish what you're doing and then go to med school.
Exactly my point. And for what Ani was saying earlier, she was saying how the residency is 1 year. I can personally tell you guys, I've reached out to so many hospitals and they're just, it's straight. You need to be a full-time 1 year. Like the job offer I was saying, it was either school or withdraw. I mean, it was either withdraw my application for school or continue on residency. And it's like no getting around it. People are like, a lot of times when I get these questions, people are like, yeah, like I can work as a nurse while going to school. You really can't, because right now I'm studying for my NCLEX. So then by the time I take my NCLEX and pass, now it's time to start school in the fall. Like, when are you going to have time for all of that? And I'm even doing a 2-year program, which is part-time, but you have 2 science classes plus 2 labs plus maybe an extra class, and then you still have to include volunteering, shadowing, clinical experience, all the things that make your application so holistic. So please, depending on where you are, take the advice from Ani.
I would just say, because people ask me this, like you're saying, literally all the time. Well, you work during medical school, so I should be able to work during medical school. And I'm like, yes, but I had already been a nurse for 5 years, working in a very intense job. And so, and I was already then, and then after working in trauma for the military, I transitioned to working in the OR for the military, seeing the same patient I was seeing in trauma, just in the OR. And then I certified as an OR nurse. So I had this huge amount of nursing experience that I could walk into my job and say, okay, I'd be happy to do a per diem job and work PRN. So I was working, I made my own schedule. Like, you don't get to walk off the, graduation stage and get that job. It just doesn't happen for you. In fact, most people would say it shouldn't have happened for me. So I even know that I am an anomaly among the people who work in per diem jobs, that I just got this really amazing position. But like, that's the thing is I was only able to do that because I had so many years of nursing experience. They knew they could basically drop me in any room and I was going to be fine.
Mm.
Like, and that's what happened is, like, I would go into work and they'd be like, well, can you do this case? And I'd be like, well, I haven't done it for like 7 years, but I'm sure it'll be fine. Or I haven't done that, but I've done something similar. And if you send somebody in to run this piece of equipment, I bet I'll figure it out. But like, that doesn't come from just like your first few months of nursing. That comes from years and years and years of experience. And so, yeah, I think that my situation was really unique, and you shouldn't anticipate that you'll be able to work while in med school while taking classes. And even I think that, if I could go back and do the whole thing again, I was too rushed. I wanted to go directly from the military into medical school. So I pushed myself to take post-bac classes while I was working full time, and then to study for my MCAT while working full time, and transferring from the military, like literally across the country from one coast to the other. So like, I don't know if I ever like I've learned the value of sit down and take the time you need to take to give it your best shot, because this is your career and this is your goal and this is your like be all end all objective. And when you're 75, I guarantee you're not going to be sitting there saying, gosh, I'd wish I had practiced for 37 years instead of 35 years. Like, no, you're going to say, wow, I had this great career. And was it really important that I like pushed myself to do it a year earlier? Like, how important was that for me? Like, what did I really gain from that? Yes, financially, you may gain something, and in the short term, that'll be good. And so you should think about your financial side. I know I'm kind of contradicting myself,
No,
but
very
take
true.
your time to do it the best you can, because this is your career that you're talking about, and you want to set yourself up for the most success.
Yeah, and I really want to emphasize the point where you said don't rush, because when doing my post-bac like application, I was gung-ho on 1 year, I was gung-ho on linkage and everything, and you just realize that it's 1 year and 2 years. It's really not a difference in the grand scheme of things. So
You
I
should
really
consider it, but if you have the ability to take the time,
right.
take the time, do it right, do it well. Don't push yourself to do all the things all at once, unless you like really have to consider what you're doing and where you'd like to end up.
Right. So another question, since you talked about the challenges of like being a nurse in med school, could you tell us something about being a nurse in med school in terms of academics? Do you feel like you had an upper hand on people? Feel like it helped in your first year or your third year? Tell us about that.
Okay, so I would say in some ways it helps, in some ways it doesn't. So, one way that it helped me was that in my school we had to take like practical exams. So we had to like pretend. So you're seeing simulated patients, and you have to see these simulated patients and make diagnoses, and then come up with treatment plans. And because I'd already been a nurse for 5 years when I started doing this during my first year, I probably was more competent than some of my peers, just because I had some experience in the hospital and seeing patients. So I was more comfortable talking to people. I was probably a little better at my time management. And I'm not saying like when I graduated, I'm still better than everybody. It's just like I walked in the door with some clinical experience.
Right.
And so because of that, my school has been trying to have a more holistic approach to selecting candidates for the honor society, for the medical honor society, because it's been observed that the honor society has some issues with lacking in diversity, lacking in minority representation, and things like that. And so my school has been shifting their focus away from purely test scores and things that have been proven to not be a good measure of someone's success as a physician or their overall intelligence in med school, and moving to this approach of more, let's talk about what really matters, which is how are you when you care for patients, what other things are you doing, leadership, research, and academics also, but kind of some other approaches also. So because of that, I really got to stand out from my peers. So I didn't know that this is what they were doing from the beginning. They were kind of quietly piloting this. So after my second year, I and three other students out of my class of 200 were told that we had qualified for induction into the Honor Society. And so for me, I can tell you that that was really great. Like it's really great to get it right away and to not have to worry about it after third year. So that's one area that I really got to shine as a non-traditional student, and it really helped me to succeed. And now, induction into the Honor Society is a really big deal. So that was really cool. Flip side, I came in with all this clinical experience, but it had been years and years and years since I had done biochemistry. And so I came into school and I was with all these people who had been out of undergrad for a year or 2 years, would even come directly. And goodness, they were leaps and bounds ahead of me when it came to like basic science questions and how to work the problems. And like this stuff was just, I like scrambled through my MCAT, and it had just been a really long time since I had done this sort of thing. So I was not prepared for that kind of basic science aspect of it, having been out of school for a long time. And because like people had gotten whole degrees in chemistry and physiology and things like that. I had just taken the prereqs and then I'd gone to nursing school, which I know it's terrible to say, but you don't need all that many science classes to go to nursing school. And then nursing school itself is actually not super heavy in the basic sciences. It's a great profession. People are very, very intelligent who go to nursing school. So not taking away from that at all, but it's not kind of the same classes and the same way of using your brain as when you go to medical school. So
Oh,
for me, it was a tough transition. So some good things, some not so good things. I think you just have to take the good with the bad and know that, people came back to me and they said, well, it's not fair that you got honor society because you were a nurse. And I was like, great. Do you want to go back and work as a nurse for a bunch of years before you come to med school? Like, be my guest. And then I'm like, and no one's offering me extra time to take my board exams because I've been out of, my basic science classes for so long. Like, this is life. Life is not always totally fair. So you just have to take the good with the bad and know that, you're going to make it work either way.
right, exactly. Yes, you're giving us pearls and jewels and gems, and we're taking them all in. And we're so happy that you got into the Honor Society. Yay, nurses. Thank you so much for that. So another question I have is, if you could go back, what would you do differently? I know you mentioned it briefly, but.
Oh, well, I think that it's hard to, I would say, oh, I do this differently and that differently and like all these things. But like in reality, I just did the next right thing in front of me. And that's how life works. Like you just do whatever the next thing is in front of you that seems like the best option at the time. And so I don't know if I would have done anything differently, but I do know that I wish I had asked for a lot more help and I had, taken more time. Like I'm saying, I was so rushed. I went like when I started in my third year of nursing school at Hopkins, I was 18 when I started. I turned 19 the week I was there, and I was a junior. And so I was like so ahead academically, but I hadn't really taken the time to consider, is this the path I want to be on? Is this the career I want? Like, and I was missing some pieces of information. Like I said, I didn't know any women doctors. So you don't know what you don't know. So would I have done something differently if I had gone back? I don't know, because past me didn't know all these things. But I wish I had taken more time. I wish I had taken the time to, like, during my MCAT, I should have waited. Well, not should have. I kind of wished I had waited until I got out of the military and done a concentrated postdoc program. Like, who cares if it takes an extra year? Like, do it right. And like, maybe I would have saved myself a lot of stress and frustration and anxiety and spreading myself like way too thin. Um, you've only got your one life. So yes, it's important to be financially responsible and get where you're going as quickly as possible. It's smart to have a plan. It's smart to have goals, but don't miss your life because you're so busy trying to get to this idea in your head of what your perfect life is going to be. Like your perfect life is the one you're living right now, not because I guarantee you could get to being and attending in whatever specialty you dream of and you'd still be unhappy if you're unhappy. Like focus on making your life what you want it to be now, even if all the like pieces in it are not exactly where you want them to be. So like I remember like two of my best friends went on this incredible trip to Iceland and Norway when I was in the military, and they asked if I wanted to go. And I really wanted to start physics because I have this thought in my mind: I have to do physics 1 now, and then I have to do physics 2, and then I have to do. So I didn't go, and I regret it to this day
Wow.
because I would have been a doctor either way, but that trip's never happening again. And so I don't know. I know it's just one of those things. You have to make the right choice for you, but don't forget about your life that you're living right now and the time that you have in this moment. Like it sounds super cliche, but
Mhm.
it's here now for you, and just pay attention to it.
Wow. Okay, definitely, like, I'm literally, like, soaking all of this in as we're going, and I'm so happy it's recorded too, so I can listen to it for motivation when I'm down, just to remember, like, this is the goal. But, I'm not sure if I asked you this question. Did you have any advice for any nurses that are looking to join this career path?
Yeah. Okay. So one thing I would say is that, yay, awesome. Like it's great. And biggest piece of advice is don't be afraid, and that it's a great thing to do, and that you should do it if it's what you want. Don't do it if you're doing it because you're like, well, I'm sick of the doctors telling me what to do, or, I see them and I kind of think like their job looks cool or whatever. Like, really think about why it is you want to be a doctor, because you can attain all of the things you want as a nurse: autonomy, independence in your practice choices, and like things you want to, your schedule. You can get a different salary if you want to get a different salary. You can work in so many different areas to have those goals. So I see people say, well, I want to be a doctor because they're in charge. And I'm like, first of all, they're not. And second of all, it's a lot of work to do, and you're not going to be in charge. Like, unless that's what you want, like in your medical field. Like, it's not like you're just going to automatically be in charge if
That
you're the
takes years of growth, years of, like, I don't even know what to call it. Not like a haze, but you go through a lot of rough patches before you
Yeah,
even reach that.
absolutely. So I'm like, really know why you want to be a doctor, because that's what people are going to ask you. I got asked this in med school interviews, residency interviews. I'm like, I'm sitting in a residency interview and they're like, well, why'd you decide to go to med school? And I'm like, well, I'm done with med school, so hopefully I decided right. But like, people want to know, like, why'd you make this switch? And it's sad because I see, to me, it's like if I woke up one day and decided I wanted to be a botanist, no one would care. But somehow, if I woke up one morning and I said, I'm done being a nurse, I want to be a doctor, somehow it's like I'm leaving this, like, for some people, it was like I'm leaving the
Very
calling.
true.
Like, I
Very
am a nurse. How can you not be a nurse anymore? It's who you
true.
are.
You
No,
have
it's my job.
even as an undergrad. Like, I haven't even started the nursing profession, and I get this question a lot.
Yeah. And so that bothers me. So I would say, don't be afraid. If you want to be a doctor, you want to be a doctor. Know why it is you want to be a doctor. And then it's exactly the same as if you decided you wanted to go, you know, I don't know, be
Accounting.
do accounting, for goodness sake. Like, no one should care, and it's no one's business. So that's one thing too. It's great because you are going to feel more confident clinically. And, I'm hopeful that going into, my hospital, that I'll be able to create rapport with the staff and build a bridge between the nurses and the physicians, because I kind of know where I came from, and now I'm in a different area. People are like, oh, well, you've got on to bigger and better things. I'm like, no, I'm just doing something different. And for me, it's better because it's a better fit, but it doesn't mean it's bigger and better. It just is a different area. And so have pride where you came from, and know that it's good. And you don't try not to get into like the situation of being like, well, I'm a nurse or I'm a doctor. You can be both. It's okay.
MPH. Yes.
Exactly.
All right, so my last question, it's a very selfish question. So what are you most excited for residency and intern year? And how long is residency? At least your program.
Oh, well, I feel like this is a selfish question, unless for me, because then I just get to talk about myself. So but Orthopedic residency is 5 years. And then after that, most people, I would say the overwhelming majority, do a year of fellowship. So it's about 6 years total. And then, I'm sorry, my nose is like so runny today from allergies. um,
So bad
but
out.
so it's, yeah, so 5 years, so 6 years total with your fellowship. And I think I'm most excited about, like, this is the last kind of transition for me from like nurse, pre-med, med student, doctor, now going to being orthopedic surgery resident. Like, for me, this is kind of finally home. Like, I've made it into the specialty I want to be in, and you don't get a lot of orthopedic education in medical school. So while people who are interested in, general surgery, have done several general surgery rotations, and people who want to do internal medicine, we do a ton of internal medicine in school. um, it's not like that for a lot of the subspecialties. And so going into orthopedics, this is, and because I was in the COVID era, we didn't get to do a lot of audition rotations, which a lot of people usually do for orthopedic education
Oh, like the
during their
away
fourth year.
rotations.
Yeah, away rotation. So that's a whole other thing. But we didn't really get to do those because of COVID. So so I do feel like this is going to be the first time I'm actually really immersed into, the field I want to be in. And that's super awesome. So I'm really looking forward to that. I'm looking forward to kind of the last stop on the journey in terms of, like, it's all up from here. So that's great. And yeah, I think that's it. And I'm excited to just, like, I'm so nervous about how the schedule, everything's going to work. So I'm excited to just get into it, start doing it, and realize that this, like everything else, is just life, and it has ups and downs, and it's going to be okay.
Hey, I'm so excited for you. Like, you don't even know. We're gonna be following your journey. I know you'll be super busy, so I'm already pouring a lot of hours of sleep to get now while you still can, and all of that. Enjoy everything now because you will go into residency and be tired, but it will be so worth it. Just like how when you were in med school you were tired, but it was worth it.
Absolutely. And I'm excited to see what you're going to do too. I think it's going to be really amazing. I'm so excited for you starting your post-bac and finishing your NCLEX. Like, these are huge steps. So
I
just
know.
excited to see you and to welcome you into the medical field someday soon.
Yes, yes, yes. Thank you so much. So we just also, on behalf of Priscilla and I, we just want to thank you so much for being able to chat with us. I know you're probably answering so many questions and giving so much motivation to many people who are underrepresented, represented, privileged, wherever they are on the path to medicine. They're definitely appreciating all of your words, and don't stop. I know you won't, because you already have shown us that you're not stopping. So keep being the best that you are. And thank you for chatting with us.
Thank you for having me. It's such an honor to be here and talk to you. It's just such a pleasure. Thank you so much.
Thank you. Bye, guys.